السلام عليكم. السلام عليكم. I would like to thank Dr. Wahidi for this presenting my background. I'm from WHO, Regional Center for Environmental Health Activities. Our regional center is located in Amman, so this is our center. It is the first LEED certified green building, first in the region to be awarded the LEED certification. So I invite you to see this building. We are responsible of the environmental health regional program in the region, and if I say environmental health, that means water, waste, air quality, food, etc. So we are assisting technically 21 countries in our region plus Palestine. So as an introduction, I will introduce the situation in our region. And as you know, we have three categories of countries in our region which are variable by their economic and social development. We have high-income countries like, for example, Kuwait, Saudi Arabia, the Gulf countries, and they have advanced healthcare services and good hygiene in their healthcare facilities, available resources to acquire state-of-the-art technologies, and some countries, and I will not mention, I said some countries, they have good practices, and some other countries, they are still progressing. We have in our region middle-income countries, take the example of Jordan, Tunisia, Morocco. So these countries, they have done some efforts on the management of healthcare waste using some donor supports and public funding. But however, still they allocate meager resources for the management of healthcare waste. I apologize for my accent because I have a French background. So they receive all healthcare waste receives low priority in some countries, of course, and there is a limitation of human and financial resources. I will be talking about this in the presentation. These are the middle-income countries, but in view of my experience, some countries are progressing well in our region in the middle income. And I can mention like Jordan, like Egypt, like Syria, but now they are in the war, but they were progressing at a certain time. So these middle income countries, some of them, they are doing some efforts. For the low income countries, and here we can mention Somalia, Djibouti, Yemen also, and some countries under conflicts and humanitarians. So they have limited human and financial resources, and there is a high risk associated to healthcare waste. So as I mentioned, three categories of countries, and please, I draw your attention that, you know, when I will be talking about the management of healthcare waste, I relate it to each of these three categories, because they differ from one country to another. Now, let us talk about the burden of this. Still, I'm talking about the introduction. Then I will be talking about the challenges we have in each of these three categories of countries. Now, for the burden of disease associated to healthcare waste, WHO estimated, and I remember it was in 2003 or 4, that contaminated syringes caused globally 20 million hepatitis B virus infection. Maybe some of you saw this on the internet, but it's a big sort of issue related to hepatitis B virus, 2 million hepatitis C infections, and 260,000 HIV infections. So this is, for some of you who knows the WHO policy paper on healthcare waste management, it is talking about this. And for the occupational health, for healthcare workers, infection attributable to sharp injuries, look how much it caused. In high and middle income, as an average values, it caused 2,300 hepatitis B virus infection, 310 hepatitis C, and 1 HIV. Now this is the high and middle income. For the low income, look at the values, it is multiplied here. You have 6,800 by 3, for hepatitis C by by how much? By 10, and for HIV by 7. Look at the situation in the low-income countries. Really, they need support. Now, for the hazards associated to healthcare waste, and as you know, healthcare waste, it includes, agents, infectious agents, genotoxic, cytotoxic wastes. Some of you, I know, they are pharmaceuticals, and they know well about this issue. And there are toxic hazardous chemicals and biologically aggressive pharmaceuticals. Radioactivity, also it's a big issue. And you have the sharps, where we have clear evidence about their, burden of disease, and it is documented. Now, if your healthcare waste include one of these, they call it blood, body flow, fluids, etc. If your healthcare waste includes this, look the type of infection it can cause. It can reach septicemia, hepatitis B, C, etc. Anthrax. It can, its healthcare waste management is an atomic bomb or biological bomb, let me say. So this is something dormant. The moment when you touch it, you will be in trouble. So this is very important and alarming. For the environmental, also this is another issue. Now, I was talking about inside the healthcare facility. You have this trouble. Now, if you don't take care of that thing within the healthcare facility, then that thing will go out and will make public health problems and, the environment. So there will be a lot of trouble. For example, you have the mercury. Our thermometers includes mercury, and if it reaches the environment, then it will reach the food chain, and we will have, our fishes. We will have the what you call it, the food sea also. It is, contaminated by mercury. And recently we have this Minamata Convention on Mercury. I think you've heard about it. And we are talking about all kinds of mercuries, including the mercury generated by the healthcare facilities. The story of antibiotics reaching the treatment plants, and particularly the convention wastewater treatment plant. Here I'm talking engineering. And it can pass the treatment and can reach, the drinking water, etc. And people, will have this resistance, antibiotic resistance, like MRSA, VRI, etc. And it has also, these antibiotics, it has a problem of occupational health. The wastewater treatment plant itself, the workers, these aerosols, if you know the treatment plant, how it is working, it includes some antibiotics, and it could be inhaled by the workers and get that antibiotics, and they will have in the future resistance for this kind of antibiotics. So the environment is harmed, people are harmed, and we have to be very careful about the management of this healthcare waste. Now, breaking the chain of the transmission of disease caused by this healthcare waste, and for some of you who knows this chain, the hepatitis B, how it is transmitted from the reservoir, place of exit, mode of transmission, place of entry, and then it enters to whom? To the sustainable host, who could be vaccinated or not vaccinated. His vulnerability could be high, low, etc. So what they do, if you have somebody who has this, in terms of infection control, now I'm not talking about healthcare waste. Now I will talk about infection control. If you have somebody who has hepatitis B virus, what you will do? You will isolate him, then you will use certain, we call it standard precautions in infection control. You put gloves, etc., barriers, in order to break this chain. So you isolate the person, then you put barriers in order to stop the transmission of that bacteria, of that virus, of that infection. So put this in your mind, very important. Isolate and put barriers in order to stop the chain of transmission of disease. This is the principle, very easy. If we understand this, then everything will be easy to do. It can be applied for pharmaceuticals, for infectious waste, for radioactive waste, for everything. So I'm using this for the students, for the private sector, I'm doing this principle, and alhamdulillah we succeeded, in transmitting the message. Now if we do that thing, because if I talk here, it's not an easy issue. When we talk about this is capacity building, this is policy, this is regulatory, this is institutional, this is all behind this photo picture. Now, if you do this, we will have a risk reduction. Now here, if you see, I mentioned something that is important also. The environmental health in healthcare facility, including healthcare waste management. Here we are talking, and we have a program, our original program talking, by the way, I'm opening a bracket here. We are talking about drinking water quality, water safety planning. We are talking here about air quality in healthcare facility. One of these is healthcare waste. So, it will contribute to the risk reduction if we take care of this, waste management and environmental health healthcare facility, then you will have a risk reduction of nosocomial infection, for example. Then you will have all this package. Look how it is nice. This package. Less expenditure on health. Very strategic. Less expenditure on health. I'm talking here about at the national level. His Excellency the Ministry of Health will be happy because the budget on health will be reduced. Less people sick. Less transmission of disease in healthcare facilities. Less environmental problems causing indirect infection to people. So less expenditure on health. So I was in the parliament in Yemen, and they were convinced of this, but it was with evidences. Efficient health services. When you take care of this, then you will have an efficient health services. The quality of your health service will be excellent, because your patient will not stay in the house, in the hospital for long term. Then less expenditure, but better healthcare services. Look at you see? Public confidence toward healthcare establishments. The public will be confident. Here I don't like to mention the country, because some countries now, some people in some countries, they don't have confidence in their government-owned hospitals, and they travel to another place to make surgery, etc. Because of this. I'm lost. Because of that thing, healthcare waste. So let me talk now a little bit about the healthcare waste. I will give you an idea about the hazards, etc., public confidence, etc. Now we will enter step by step into the healthcare waste management. What is healthcare waste? Some of us know, some of us don't know. So healthcare waste is the waste generated by the healthcare settings, healthcare activities. You know everybody this. 75-90% of that waste is general waste. 75-90% to 90%. The rest is hazardous waste. Between 10 and 25%, it is hazardous. Look how much it's small. We have to take care of it. And when it enters, when it is mixed, then it will become a big, mixed with the general waste, it become a big problem. When we isolate it, it will become a small problem, and we will invest less, and we will protect our environment and health with minimum funding. Now there is a question mark there, the 10%, the famous 10%. One of my publications, it shows this 10%. Some of you can tell me about this 10%. What is behind it? That means, you will put all efforts so that you will be enriching only 10% of that waste produced in the waste is hazardous. Now, in order to reach this in Oman, recently I was there, and we put the policy, we said, how you can reach this 10%? It's a big issue. You need capacity building, you need to have a policy in place, you need to have capacity, people, good financial also system, private sector working, etc., in order to reach 10%. Now in general, in Oman we are talking about 25-30% حقيقة يعني 25-30%. But in the policy and the strategy, we were putting goals. How to move from that 30% until 10%. I remember I think we were talking about 5 years in order to reach that 10%. Because you need sort of a policy, institutional framework, good legal framework, enforcement, inspection, private sector should be doing things 100%, etc., etc. So now for the production of healthcare waste, and this is from the WHO guidelines, the former one. Now we have published a new one. So the production of healthcare waste, it is from 1.3 to 3 kilogram per bed per day. And if I say this, that doesn't mean hazardous. Huh? You have to divide by 4, 25%. So 25% of 1.3, it is 0.4, 3 by 4, 0.75. That means 400 gram, from 400 gram to 700, 800 gram per bed per day. You see? So this is in 1991 in our publication. Now, in the new publication, 2-3 months we published the new WHO guidelines. Alhamdulillah, I'm editor, lead author, and the author of chapter 40. So we will be talking about this. So in our guidelines 2013, we published this. So my friend Emmanuel, he made a study, and if you see here, you have this guy, these 2 lines. They are between 2 and around 5. So kilogram per bed per day between 2 and 5, that means if you count around 25%, you will have the hazardous part of the waste. It is between 500 gram and 1.2 kilogram, which is reasonable. You see, you have Kuwait here, it is around 8. Well, normally shouldn't be 8, but yeah. But I'm talking in general about the general trend. It is between these 2 lines, which is reasonable. 500, between 500 gram and 1.2 kilogram, which is reasonable as hazardous healthcare waste. Now, I will be talking about the challenges. I will talk about the introduction, the hazards, etc. Now, we will be entering in depth talking about the challenge in our region. First of all, I would like to mention one thing that is very important, is that the healthcare waste management policies in our region, they are not aligned with the international conventions. This is unfortunate that our governments, they are signing, ratifying international conventions, agreements, global frameworks, but sometimes, or for most of the cases, their policies, and here I'm talking in general, there is not aligned with this international agreement and conventions. And particularly I mention here the healthcare waste management policy. If there are healthcare waste management policy, they are not aligned with these conventions. And these conventions, the new one, Minamata, I mentioned the Mercury Convention, Basel, some of you know about it, and Stockholm Conventions on persistent organic pollutions, the Patient Safety Infection Control, WHO Program on Patient Safety, Occupational Health, the Global Framework, the second, new one, strategic approach for international chemical management in the health sector. This is a strategy for the private sector now to implement it. So it's a WHO document, it's an excellent one. The WHO policy resolution also, the greening the health sector now, the sustainable development, Rio +20, excellent document, the future we want, that was, mashallah, that was ratified by many countries recently. And we talk about the green, and now WHO, we are talking and promoting about the greening of the health sector. Here, I shouldn't go in depth on that. Let's stay in the healthcare waste management. But these are the conventions, and our countries, when they ratify, they have to implement. This is an important message that we should convey to the policy makers. Very important. Okay? So, let's move to our region and the major challenges. We have 5 major challenges. Of course, the challenge I this is for low-income countries. ممكن ما بيخصش الكويت. ممكن maybe doesn't relate to Kuwait, but I have to say something about it because we have in our region some low-income countries. So we need to have it's very important because here we will be talking about something that maybe Kuwait needed. In Saudi Arabia, I was there. In Mecca, Jeddah, Riyadh, and Dammam, and Khisam Sheikh, etc., and Abha, and I saw that they need the mini WHO minimal program. The WHO minimal program. This is when I'm talking about it. So here we apply for these low-income countries the WHO minimal program, where you use low-cost technologies, low-cost practices in order to meet the minimum for the public health, minimum requirements for public health. So, coming back to the challenges, look at this. I think these photos, you know them. These are my photos for your information. I took them in some countries. I don't like to mention the countries. But you know, for us, if you look at these photos, some of you say, oh, this is ugly, this is... But we professionals, what we see behind this is the point. We see that there is no policy, no people aware, no regulatory framework, no institutional framework, nothing. This was, look at the blood mixture. Look at this, how it is transported. And it reaches the landfill. And there are people in the landfill. There are cities. There are, you know, how much it will affect people. You know, it is just near a policeman who was sitting here. And I told him, what's this? He said, this is not my responsibility. Look, he is near the chair. So maybe he was infected. He doesn't know that he was infected by some, you know, some kind of bacterial viruses. Who knows? Now here the immunization campaign. Yeah, I will say it in Sudan. So here, no, they are not aware. Safety boxes, they put the doses, they put everything, they are not aware. Yeah, I mean, this is very simple things and people, they are not aware. So we had here also, they are burning in the waste, and here it was near the pediatric department. It looks like a landfill. They are burning the waste here. So it is awful, it is ugly, it is very bad. And the director of the hospital was somebody who is aware of this kind of why they are going for such things. You know. So we changed it now. Everything was changed. Alhamdulillah. You see here also on the, you will see the scavengers. They have the catheters and they have the tubings, drainage tubings. The guy, you know, he was taking, you know, syringes. You know, immediately I told him, where is syringe? He told me, look, you shouldn't touch it. He's not aware, this guy. He can transmit that virus, that bacteria to the public, to his son. And his son will go to the school and he will affect he will contaminate his friends. So it's a public health issue. We have to understand. This is the message that we have to have. Now look at this. Look at this photo, you know. Yeah, I mean, هذا كان incinerated. It is an incinerator. It was stopped, you know. It is in the middle of the city. Here, look at this. This is the municipal collection vehicle. It is pressing the waste and عندك العصيرة. This is the juice. The juice, you know. Look at the blood. Look at the syringes. Very bad pictures. And here I have a story that I will talk about it in the coffee break. Because it is very, very sensitive. Very sensitive. And it reaches the Ministry of Interior. And I was there and we stopped everything. I will not mention the country, but in the coffee break I can talk about it. Now here, recently I was in Libya. Libya here. Look at this storage area. Look at the medicine, the drugs. These drugs will cure people. How they will cure? Some of them they are expired, some of them they are... Look at what they will do. 100,000 tons of expired drugs, ya Habib. Look. How they will do this? this kind of issue. We brought an Italian company and we were talking millions of dollars and help. There is no policy on pharmaceutical management. There is no strategy. طلع شوف يعني there is no inventory at least to know, no stock management, no stock rotation, nothing. You see, so everything we go to the landfill with certain encapsulation. Anyway, this is technical. We have done a lot of things and we choose the place and it will take at least 2 years to get rid of this 100,000 tons only. Now, the approach to reduce this healthcare waste management risk in low and in some middle income countries, we use the WHO minimum program. This is very important. The WHO minimum program, we talk about the 3 bin system, one for general waste, one for the sharp waste, and one for infectious waste. And by the way, some of you will say, why 3 bin system? Why in our hospital is not? It is 5. Why in a large hospital we have 6? Here my response. 3 bin system, the infectious waste is 80% of the hazardous waste. So if you solve the problem of infectious waste, that means you solve 80% of the problem of infectious waste. That's why we looked into the 3 bin system. Any system you would like to build it, you have to start from WHO minimal approach. And the new WHO guidelines, alhamdulillah, they voted for me. And we were talking in each chapter, inshallah you will see the WHO guidelines. It was my proposal, alhamdulillah, that each chapter in WHO guidelines should talk about the minimum, the red. Where is my red line? You have advanced it. But where is my red line? The WHO. What is the minimum? It was difficult to do it, but we had done it. In the legal, in the policy, in the managerial, in the financial, everywhere you will see the WHO guidelines, it's talking about this. Very important. So the WHO, remember this. And I will show you, this is in a large hospital. Like one of the Kuwaiti hospital, advanced system. Look, the WHO minimal approach, what it has done. It solved the big problem. Look at these huge charts. One day, they told me by phone that, the supply of the sharp containers, it is not reaching us. So what you can do? I told them, look at the WHO minimal approach. You have contingency measures. You can do the WHO minimal approach or procedures in solving your problem temporarily in large advanced hospitals. So they put this while waiting the supply of the usage of the containers. So they put this, look, this is the WHO minimal approach, use it as a contingency measure. So you can use it in Kuwait also. And sometimes people say, wow, how we can do, things that they have been done in Somalia or in Yemen. No, you can do it temporarily to solve your problems. Otherwise you will put that user charts here or there and it can reach, and impact people. So this is another WHO minimal program, the high infectious waste that is generated in the laboratory. Quickly dishes هدول they are very high infectious. And the WHO minimal program say what? You need to have an autoclave in the lab in order to reduce the high infectious, the bacteriological load within that waste to become infectious, not highly infectious. So this is WHO, it is a must. In Somalia, in Yemen, it is a must. In a small, even healthcare facility. It's not expensive, $200. $200, you put water here, and you put the waste and you close and you will have, cocotte, like cocotte in French, for cooking, normally. So I think you know about this. Now the challenge number 2, very important, and this is for the middle and high income, is to improve, sustain existing healthcare waste management practices and systems. This is very important because we need to look from time to time to our system, update it, maintain it, build those who are working in the system. So we need to review the policies, define the roles and responsibility of responsible persons, define or update or review. Human resource development, very important in the Gulf, because you have many overturns within your healthcare facility. Today you train, tomorrow people will go and other new people will come. So you have to have a strong national human resource development program. And this is what I'm suggesting for Kuwait really. It is now in Saudi Arabia now. For Kuwait, they have to have a national program for capacity building in order to maintain people, train people, and keep them aware of the waste management, so that your system will keep operating in a very good way. Allocate financial resources for sound and safe management. Here, I have a special slide for this. We will be talking about the budget line, etc. Procure healthy and environmentally friendly technology for treatment of healthcare waste. This is also, it has to do with greening healthcare facility in Kuwait. We need to talk now about greening. Recently, we were in Qatar and we developed the environmental health standards for accreditation of healthcare facilities, environmental health standards, and they are three: core and critical and developmental. So we were talking about this for accrediting healthcare facilities, and these standards include healthcare waste. So here in Kuwait, we need to look into this, of course, these kind of things. I have no idea, but I think greening is important and should be included in the accreditation of healthcare facilities. I think Dr. Shakti, he was with us. He's not here. He was with us, and he was a focal point for Kuwait at that time. Encourage research in the field of healthcare waste management. This is very important. We need to have epidemiological studies, risk assessment studies, in order to generate more and more evidences to convince our policymakers about the burden of disease associated to healthcare waste management. So this is, in some middle income, here in Jordan, here in Saudi Arabia, I'm mentioning the countries, they are doing good efforts. And inshallah in Kuwait, I'm sure, in Kuwait they are doing very good. I'm sure about it. They have resources, they have good people, they can work on that easily. Now the technology also in some middle income, because I said some country in the middle income, in the middle region, so they have done some efforts. So this kind of technology exists in our region. This autoclave, the gravity displacement autoclave. This is EcoDAS, the shielding system. I don't like to enter too much in the technology, but these are two, they exist. Saudi Arabia, in Syria, for example, we established this, but now I don't know what is the situation. It was a centralized facility. Here also, the EcoDAS system, P1000, P2000 also, it was established in the facility and also as a central Lebanon also, they were working on this, in Morocco, in Egypt, and in Cancer Hussein Center in Jordan, so they have this kind of machines. The challenge number 3, integration of healthcare waste management within the existing healthcare activities and programs. For example, within the infection control, injection safety program, patient safety, immunization. We need to have healthcare waste because these are healthcare activities. So we need to have a healthcare waste management component integrated within this activity. And that's it. This is the point, the message I would like to. For the financing of the management of healthcare waste, one of the problems we find is there is no budget line for healthcare waste management and healthcare facilities. This is one of the biggest problems. The heads of hospitals, they are in trouble. They don't like from where getting the money to allocate. They cannot report. Healthcare waste management, it is under overhead. Sometimes it's not. There is no special accounting for that. So they don't know what is the cost per kilogram. And if you don't know the cost per kilogram of waste treated and sorted, you cannot plan as a decision maker. You cannot prepare a plan. You cannot know you cannot have a vision how much you will spend, how much equipment you will have. Financing is very important. And if you say financing, also the reporting of the financing doesn't exist. So here, this is a problem. Another problem reliance on external funding. And here I explain more. Some countries, they rely on donors. They rely on donors for what? For purchasing equipment and operation of the equipment. Very bad management. For financing the equipment, okay. Some countries, they are poor, they can request some external funding to provide, some equipment. But the operation, they cannot sustain the operation of this. You, as a government, you have to have operation. You have to have a cost recovery mechanism in order to what? To cover the cost of the operation of your healthcare waste management system and the amortization of the equipment you get from Europe through that donor. You see, here we are talking too much about budgeting, but it's not technical, but I hope that the message is good. Now, these are the challenges. I will keep it for you. Challenge number 5, emergency and conflicts. Emergencies and conflicts. We are in trouble now. Our region, we have a lot of emergencies and man-made conflicts and natural disasters. And we witness a collapse in the healthcare waste management systems. Like, for example, in Syria. Honestly, I was working too much in Syria, and now it is collapsing. Lack of resources, high risk, كبير, and the absence of minimum requirements on healthcare waste management for protection of the health of people. It doesn't exist. So in our guidelines, inshallah, it is in the internet WHO site. So chapter 14, this is my chapter, alhamdulillah. So we were talking about this, how we can solve this problem in the emergencies. So what we are currently promoting in our region, what we are promoting, this is what we are. It exists. I copied it. It exists in our WHO policy paper on healthcare waste management. We need to look at the Basel Convention, look at the the Stockholm Convention on persistent organic pollutants. We talk about mercury, etc. I will not talk too much about this. Supporting, preventing the health risks, reducing the exposure to toxic pollutants, etc. These are the WHO guiding policy principles. When you draft a policy, it should be in line with these few things. The implementation of that policy, of course, we implement it with these programs. Community-based initiative, you can have this. You implementing the emergency, with infection control, etc. I was talking also about this. So implementation of that strategy, the policy first. Now, of course, like I mentioned, healthcare waste management should take into account the global convention agreement, like I mentioned in the beginning. So no need to go back. Now for the planning. This is very important. I will be talking about two things. The planning at national level and the planning at hospital level. This is now what we are promoting in the hospital, in the region. Now, our planning should start for the low-income countries by the WHO minimum approach. Very simple at If you would like to plan, you are a low-income country, first lane is the WHO minimum approach. If it is okay, then gradually improve it. If it's not okay, stay there. Stay in the WHO minimal program. So this is a message. And it can work in Kuwait also. Some healthcare center in Kuwait, 200 kilometers from the city, Kuwait city, they can apply this. Now, our national plan includes 6 objectives. You have to have clear regulatory framework, rationalize the healthcare waste management, healthcare facilities, develop financial resources. In the coffee break, I can talk, respond to any question of this. Launch capacity building, set up a monitoring plan. This is very important, the monitoring plan, where you have an information system, you have indicators in each hospital. Then, that information, the flow of information will reach into His Excellency, the Minister of Health. On his board, our computer can know what is happening in that healthcare center. I was in Iran recently, and Wallahi, they have a GIS. A GIS, they click on the map, and you will have, on any نقطة في المap, And we have, all the information about health, about healthcare waste, about excellent. I hope you see this in at least in the Gulf countries. Kuwait, for example. Why not? I mean, these years. His Excellency Minister can make a decision on his without even bringing his advice. He see everything in front of him. Very important. So this is the national plan. Now, there is another plan. I said national. Now, the plan should be in the healthcare facilities also. You have to have a plan in the healthcare facility. Just to draw your attention. Some countries, they started planning in the healthcare facility in order to trigger the development of the plan. Some other countries, they started by the national plan and they worked on the plan for healthcare facilities. In Jordan, for example, we start from the bottom and then we reach the national planning. I think in Pakistan, we started by the national planning and we reached the plans in healthcare facilities. So depending on the country, but the essential thing is to reach the objective. المهم نوصل على الهدف تبعنا العربية. So our plans should include all these. Should have relations. Healthcare waste, for example, should have مع emergency relation. Should have مع chemical safety. Should have مع جماعة pharmaceuticals. Our plan should be connected to the pharmacists. Yes, because I have some expired drugs. I have some powder, I have some I don't know, etc. So the pharmacist, I should, as the WHO, as the waste management officer, I should have a connection with that guy in order to put his recommendation in my plan. Of course, within the healthcare facilities. Now the way forward, 2 slides. The way forward. Promoting WHO minimal approach. I was talking about it. And we can talk about the coffee break if you have any question. Training, awareness raising, supporting the development of national policy, legislation and plans. Go for national and local plans. Continue supporting development of hospital plans. I was talking about it. Continue, I said. Research, very important. Promote non-incineration technologies. I am the one who is for these non-incineration technologies. So, كثير بنشجع في الموضوع هذا. Support establishment of cost recovery mechanisms. Continue, I said. Private sector involvement, very important. بس شو? I need to have the private sector. That's one thing. I need to have a good cost recovery mechanism باش نخلص البرايفت سيكتور نتاعي. And it should cost sustainable cost recovery. And I should have a good inspection system. أنا بخلصك بعطيك مصاري. I give you money. And they should inspect you. So, according to the legal framework. In line national policy, I was talking about it. Establishing best practices for liquid healthcare waste. مهم جدا. I didn't show photo on liquid, but liquid is very important also issue. This is the new WHO guidelines. So, site, I don't know where is the site. But anyway, put the name and you will get it. So it is 300 pages, it's fine, it is a big one like that, because it includes the WHO minimal approach and the emergency. So this is, I am one of these, الحمد لله يعني. العربي الوحيد يعني إن شاء الله دايما نقاوي إن شاء الله. And this is the documents, our center, we developed these documents, most of them they are my documents of course. But الحمد لله يعني, our center we are doing the well and we are ready to help, any country in our region in this field. والسلام عليكم. Thank you very much.